Looking back, I don't think I realized that pharmacists do as much as we do. Is the market saturated? How much education does pharmacy require? Is pharmacy for me?
Get your life, plan it out. You can go as far as you can dream. Edges lay, curls popping. She's a doctor of pharmacy.
Hey y'all, and welcome back to my YouTube channel for another video. Today's video is going to be a pharmacy video. Anyone who's on the fence or leaning towards becoming a pharmacist, I wanted to come on and tell you firsthand what it's like to be a pharmacist, what opportunities are available, and what things to consider if you are leaning towards pharmacy. Alright, so let's get right into it. The first question I want to address is, what is a pharmacist? So within the healthcare profession, you have a lot of different specialties: respiratory therapists, nurses, physicians, pharmacists, your lab technician, your phlebotomist. There's so many people, social workers that are on the team, right? And I know I'm missing a ton more because the team is just so large, but you have a large team of healthcare professionals. So the pharmacist on the team is essentially the drug expert, which means we can dose the medications, we can manage the medication doses and the directions. So if we want the patient to increase or decrease their dose, we can manage that. We can teach patients about side effects. So we are the experts as far as drug-drug interactions, which drugs are going to work well together, which are going to work against one another, identifying what may not be recommended for a patient. So if they have any reasons why they should avoid this medication, the pharmacist is going to be the one to bring that knowledge to the team. So once they're diagnosed by the physician, essentially the team is depending on the pharmacist to come in and have that wealth of knowledge about medication. So that's number one. We are the drug experts. Number two, we are the most accessible healthcare professional, which means that pharmacists all over see the most amount of patients daily. So what does that mean? You think about your community setting, so your Walgreens, CVS, Walmart, your independent pharmacies. We have a consultation window. Patients are coming up to our window daily, asking us questions about their medication, calling us 1 a.m. in the morning, asking if it's safe for them to take this medication on an empty stomach or with food, wondering if they can start a new medication that's over the counter because they take all of these other prescribed medications. Whatever questions they have, they're reaching out to pharmacists because we're so easy to access. So that's important. That was important for me when choosing pharmacy, because I truly enjoy helping patients and discussing different therapies with them. So if you enjoy talking to patients, looking at drug interactions, discussing therapy with patients after they've been diagnosed, pharmacy may be the career for you. I also wanted to touch on some of the tasks that pharmacists do in different settings. So if you're watching this video and you're leaning towards pharmacy, you are probably leaning towards community, so your CVS, Walgreens, Walmart, or independent, or maybe you're leaning towards hospital. But did you know that pharmacists can work in a government setting? You can work in industry and informatics. So there are pharmacists that work pretty much an IT position for pharmacists. When you are admitted into the hospital or you go to your doctor's appointment, they chart all of your notes electronically. Sometimes there's a pharmacist behind that system that's coding and doing things beyond pharmacy knowledge. You have to have an IT eye for those type of things, but there are pharmacy jobs in informatics where that's what you focus on. You can work with pediatrics, so maybe you want to work in neonatal units with premature babies, infants. You can do that as a pharmacist. You can manage their medications, manage their mother's medications. You can also check for any drug-drug interactions. You can also work in an outpatient setting. We have an area of pharmacy called ambulatory care, where patients come see their pharmacist only for chronic disease state management. I thought that was the coolest thing as a fourth-year pharmacy student. Seeing a pharmacist in that space just kind of lit my eyes. It was like I unlocked a whole new world of pharmacy, and really that's actually what I went through residency training for, ambulatory care. So essentially you are working with patients one-on-one, discussing their chronic disease state, anywhere from 30 minutes, sometimes up to 40-minute visits. So you have more than enough time to get to know your patients, discuss their therapy, and also come up with a treatment plan, working directly with the physician, the nurse practitioner, whoever the healthcare team consists of. You're working directly with them to help manage that patient. So if you enjoy talking to patients, ambulatory care pharmacy may be for you. Maybe you say, I don't really like talking to patients, I want to be more behind the scenes. There are so many career options with pharmacy. You can work in the Public Health Service, the Center for Disease Control. You can work for the Federal Drug Administration, the FDA. You can work as a retail pharmacist, so your CVS, Walgreens, that type of setting. There's so many options with pharmacy that I don't think a lot of people realize. Definitely understand that pharmacy is a wealth of knowledge, but it's also a very flexible profession. How much education does pharmacy require? That's a great question, and you're probably thinking that through as you decide if pharmacy is for you. So there are several options and routes that you can take. They have 2+4 program where you do not obtain a bachelor's. You have 2 years of undergrad plus 4 years of pharmacy school, meaning you're a pharmacist at a younger age, which is a plus. You're going straight through, so you're not spending 4 years getting a bachelor's degree and then going into pharmacy school. A lot of people prefer that. If you feel like you know 150% that you want to be a pharmacist, regardless of anything that happens within the pharmacy profession, then definitely I would recommend a 2+4 program. It's going to be rigorous because you're not going to get that full solid 4-year degree. The con is that you don't have anything to fall back on. So say you finish your 2 years of undergrad and you start your 4-year pharmacy program and you realize pharmacy is not for me. You don't have a degree to fall back on, right? So you'll have to go back to undergrad to complete a bachelor's degree. Now the option I chose to get my bachelor's degree in chemistry. So I did a 4-year program in undergrad, and then I did an additional 4 years of pharmacy. So right now I have a bachelor's in chemistry and I also have a doctorate in pharmacy. If for any reason I wanted to leave pharmacy and get a job in chemistry, I could very well do so because I have that to fall back on. And at the time when I was choosing pharmacy school, I wasn't quite sure which route I wanted to go. And so that's why I chose to go ahead and get my degree in chemistry before moving on to my next step. So you have the 4+4, which is the option I did, 2+4, where you do not have a bachelor's. There's also accelerated programs, so you can complete pharmacy school in 3 years. Now with a 3-year accelerated program, you may not get your summer breaks. It's gonna be very rigorous because you're condensing the time spent in the curriculum. But at the end of the day, you still get the same education. A lot of students in pharmacy school are non-traditional, meaning they're older, they have families, they may be married. If you are doing a non-traditional route, that's perfectly fine. We have students who, I say we have because I've taught at pharmacy schools as a resident. I've been in pharmacy school, so I've interacted with a lot of pharmacy students. There are non-traditional students who majored in social work, psychology in undergrad, and then decided to become pharmacists. That's very much doable. You do not have to major in your core sciences. As long as you complete your prereqs, you're good to go. And each school has different prerequisites, so definitely check their website to see how many credits you need in each of the courses that are required in order to apply for the program. Another example of a non-traditional student, we've had students who are practicing and registered nurses, who have been veterinarians, I mean, you name it, and I've seen it, lawyers, that come back and go back to school for pharmacy. So if you're watching this video and say you are not fresh out of college, you've already been in your career for X amount of years, it's not too late to switch to pharmacy. To this day, I would definitely recommend it. Is the market saturated? It depends on what market we're referring to, right? So community, retail setting, absolutely. That's becoming overly saturated. They're cutting pay. It's getting hard to find hours, right? It's getting hard to find employment, but that's just one sector of pharmacy. You following me? So that's only one small portion of what pharmacy has to offer. And I always stress that. You hear a lot about it's overly saturated, don't do it. There's a decline in how many applications pharmacy schools are getting for pharmacy. And while all of those are very true, there are also infinite opportunities in pharmacy. I've had classmates graduate and create their own opportunities within clinics, within healthcare systems, being pharmacists in unique roles. So if you are someone who dares to step out and create your own position, you can definitely do that with pharmacy. If you choose to do residency, so residency is an option with pharmacy, which just allows you to get additional on-the-job training. It's pretty much after graduating from pharmacy school, residency is an additional 1 to 2 years, optional, where you essentially go through an application process, you interview with the programs, and sometimes it requires relocating. So they have programs all over the US. You can relocate or you can stay local. But essentially you are a pharmacist, you're taking a pay cut for residency. However, you're learning a wealth of knowledge from other pharmacists, which we refer to as preceptors because they are pretty much your supervisor. They oversee what you're doing. Absolutely recommend a residency. It will take you far in pharmacy. When I say the opportunities are endless, they have health system administration residencies. So essentially you are the boss overseeing all of the operations at your hospital, specifically in the pharmacy. They have that informatics route that I mentioned earlier, geriatrics, which is the older population. If you're interested in industry They have fellowships available. There's so much additional training that you can get as a pharmacist as well. If you are interested with healthcare profession, you want to help people, and I think that pharmacists definitely play that role in so many different capacities. We help patients inside the pharmacy, outside the pharmacy. We help them in between their doctor's visits. So currently I manage patients with diabetes, and as a pharmacist, I'm able to see my patients in between the time that they see their doctor. How cool is that? So they come in and see me for a visit, and we discuss anything from medication changes. If their sugars are dropping low, how can we manage that? If they forget to take their medicine, what do they need to do? If they experience side effects, how do they handle those? All of these are common questions that we get directly as pharmacists. As your physician, they're going to do an extensive physical exam. They're going to gather all of the information they need from the patient, and they're going to give you a strong diagnosis. Once that patient is diagnosed, they may or may not have the time allocated in their visit to speak with the patient about all of these other factors that come along with that treatment plan. So as a pharmacist, we jump in and fill that gap and make sure that we grab the medications and spend time with the patient one-on-one, going through all of their medications. So I really love that aspect of pharmacy. And honestly, looking back, I don't think I realized that pharmacists do as much as we do when I was considering pharmacy or medicine. By the way, if you have not checked out that video, if you are also watching this video and you are considering pharmacy or medical school, I will link it above. Make sure you check that video out. I discuss reasons why I chose pharmacy over medical school, because I also was on the fence about whether I wanted to do pharmacy or medical school. But outside of that, I've really enjoyed being a pharmacist. I would not trade it for the world. I do feel that there's a lot of education that still needs to get out to the community about what pharmacists do and what we don't do. So many different steps involved, and that's just in retail pharmacy. In the hospital, there's an extra added layer, right? Because all of your medication is dosed for what your labs are looking like in that moment, versus the outpatient setting at a Walgreens CVS, you're getting maintenance medications 9 times out of 10, or an antibiotic that's already been dosed prior to you arriving. As you can tell, I can go on and on about pharmacy. Absolutely love it. I would definitely recommend it. Is the market saturated? I will say this again. Yes, if you are referring to retail. Should that prevent you from becoming a pharmacist? Absolutely not. Absolutely not. There's so much more out there to offer. This is my personal opinion. I strongly believe that pharmacy is just getting started. We're just getting started. We're getting prescriber authority, so we're able to prescribe in some states. Just as your physician writes your medications, we're able to do that. Also, there's discussions on contraception being made readily available in the outpatient setting. So at your retail pharmacy, there's discussions in different states, and some states have already enacted this, where you basically can come up to the pharmacy, even if you don't have a primary care doctor, and you can ask your pharmacist, speak with them about your interest in starting oral contraception, and we can write you a prescription. How cool is that? So there's so much happening in pharmacy, and we're just at the tip of our breaking point. So if you're interested in pharmacy, definitely consider it. Strongly consider it. I would not trade it for the world. I hope y'all enjoyed this video. If you have any further questions, please drop a comment below and let me know. But other than that, I will see you guys on my next video.